Hello to everyone, and in this video we'll be doing a brief discussion on the topic of classification of malignant tumors, the case of cancers and different types of tumors. So first of all, this malignant oncopathology is classified in several ways, and it is classified on the basis of type of tissue in which the tumor occurs, that is the histological type, and according to tumor name classification, that is a TNM system, that we will also discuss in the later video. So first of all, depending on the types, on the histological variations, we have 6 types of tumors, and first one is your carcinoma, and second comes your sarcoma, third is your myeloma, and leukemia, blood cancer, lymphoma, and the mixed types. So these are the 6 types of cancer we will be discussing in details, tumors, on the basis of histological type. Now first we have is the carcinoma. Carcinoma refers to the malignant neoplasm of the epithelial origin, that is the epithelial layer of our skin, from where it develops, that is the origin of this carcinoma we say, and it is actually present in the skin, as I told, the epithelial layer, and it also lines the surface of internal organs, that is the gastrointestinal tract, and it is the most common and the most dominant type of tumor, that is carcinoma. 80 and 90% of the cancers are of carcinoma type. Now we have 2 subtypes in this carcinoma. We have adenocarcinoma and we have squamous cell carcinoma. So these are the carcinoma on the basis of histological type. Adenoma, it relates to your glandular tissues, and that is it spreads to your soft tissues, the glands which are present. So there, it can be any type of gland in the body from where it can be developed. Now squamous cell carcinomas are actually in the squamous epithelials, which are actually present in the lungs and uterus. So the organs which are developed of this epithelial or histological variations will be developing this type of carcinoma. Now we can see in this image, you can see the GI tract, as I told you, it is the most common. So in this you can say the stomach, you can see this is your stomach lesser curvature in this diagram, clearly you can visible, and this is your greater curvature. So if you can see the zoomed view of this carcinoma, so this is the lesser curvature part where your carcinoma has been developed, and this is your stomach wall, you can see stomach wall, and this is your carcinoma. Okay, so now next one is your carcinoma. Now carcinoma, you can see this has been developed here, the bulged tumor part, and this you can see in the layer of the stomach, the mucus layer on the soft tissue. Okay, so this was the presentation or picture view of the carcinoma. Now next, as I told you, this is in GI tract, and most common organs for this carcinomas are breast, lungs, colons, prostate, or bladder. So these are the most common cancer or carcinoma where it develops. Now comes your sarcoma. The third classification we have is the sarcoma. Sarcoma refers to a tumor that occurs in the supporting or the connective tissues such as bones. So you will see the mostly the sarcomas in the bony parts, tendons of the muscles, cartilaginous part, muscles, actually in the muscles also, and the fatty regions. Okay, and is usually seen in the young people, and it's often developed as a painful mass on the bone. So the symptoms can be very painful when this type of tumor occurs in your body, so you can feel the pain sensations. Now examples are osteosarcoma in the case of bones, chondrosarcoma, we use the term for the cartilage, leiosarcoma for smooth muscles, rhabdosarcoma for skeletal muscles, liposarcoma for adipose tissue or fatty tissues, and glioma or astrocytoma is the connective tissue of the brain. So the brain, the cancer in the brain, we use the word astrocytoma or gliomocytoma. So these are your sarcomas. Now comes your myeloma. So myeloma is a malignant neoplasm that occurs in the plasma cells of the bone marrow actually. So it produces proteins which are found in the blood, that is the immunoglobulin G. So myeloma is a malignant neoplasm that present in the plasma cells of the bone marrow. Okay, so the third type. Now comes your leukemia. Leukemia is related to your blood cells. Okay, WBC actually, white blood cells, and when they do not function properly, and in this case the leukemia is a bone marrow tumor often associated with overproduction of immature WBC that do not function properly. So the patient with this disease is often prone to infections, so they have the more chances of developing any type of infections, viral infection, bacterial infections, because they have immature cells, WBC cells, which fight against the infections, so they are not able to develop that cells. And it also affects RBCs also and your platelets number also, so it can lead to the symptoms of anemia and problems with the blood clotting. So these are the other symptoms which can occur in the case of patients of leukemia. Now we have the myelogenous and granulocytic leukemia in this examples, and lymphoblastic leukemia in the lymphoblast cells of the blood, and we have erythemia or true polycythemia. True polycythemia, whereas a different disease, which in this case we can develop leukemia. So this is your blood cancer. Now comes your lymphoma. So lymphoma is actually develops in your glands, nodes of the lymphatic system. By the name it is clear, it's in the lymphatic apparatus or lymphatic system of the body, and it occurs especially in the spleen. Spleen is a tonsil is our, and the thymus. So these are the more organs, more prone organs to this type of malignant tumor. And this tumor can also occur in the stomach, chest, and brain also in some case, and in that case we called it as extranodal type of lymphoma. Now we have two types of lymphoma, Hodgkin's lymphoma and non-Hodgkin lymphoma. In this case we can differentiate by histological variation, like we can see Reed-Sternberg cells which will be present in the Hodgkin lymphoma, and in the case of non-Hodgkin it will be absent. So there is a major difference on the histological type. We can differentiate this type of cancer. Now comes your mixed type. In mixed type we have adenosquamous tumor, mixed mesodermal tumor, carcinosarcoma, teratocarcinoma. So these are the terms we will use in the case of mixed types. Now you can see this rectal and the sigmoid tumor. You can see the example here in this image, rectal tumor. So this is a normal anatomy cross section, and this is your actually your sigmoid colon, the cross section. So here you can see the developed mass of the tumor. So this actually is your rectal tumor in this image. Okay, so like this the tumor actually are visible on the section of your presentation on the picture view. Okay, so now let's move on to the divisions of malignant tumors on their location. So on the location we have lung cancer first, and then we have malignant neoplasm of bone or soft tissues, brain cancer, skin cancers, and hematological malignant neoplasm, as I told you, in the blood, in the breast, in the skin. So these cancers are on the basis of your location. And tumor of unknown origin, we don't know the origin of the tumor. So that is the last type. Now what is a TNM cancer staging system? Now TNM stands for T for tumor, N for nodes, M for metastasis. Now T0 means we will just assign a number. T0 is no cancer, N0 is no regional spread, T1 to T4 will be determining the size of the tumor, and N1 to N3 will be determining the spread of the tumor through the nodes of the lymphatic system. Now M is for metastasis, so there will be M1A, M1B, M1C. So how far the metastasis has been developed, that we will be deciding through the letter M. Now TNM system stages of oncopathology, we have 0 stage, what is called as cancer in situ, that is a pre-cancerous stage in which we use the symbols like TIS, NO and MO. So these are the terms we will be using for denoting this type of stage, which is called as cancer in situ. This is a pre-cancerous stage. So we have developed the cancer, but it can be developed very soon. So that is the stage called 0 stage. Stage 1 is your localized cancer. Stage 2 is your localized cancer with advanced cancer state, that is the early stage. Stage 3 is your locally advanced cancer and later stage. Stage 4 in which the metastasis develops, so that is called as metastatic cancer, and is developed by T1 to T4, which will determine the size, N1 to N3, which will be determining the spread through lymphatic apparatus, and M1 will be determining your metastasis, how the level of metastasis. Stage 5 is your reserved for Williams tumor. Stage 5 is the last stage or advanced stage in the case of TNM system for oncopathology. Okay, now comes your statistics. If you will see the statistics for this oncopathology or malignant tumors, we have the risk of developing neoplasm in 0 to 75 years of age, means from birth to the age of 74, and in this case we have a 20.2%, and out of this we have 22.4% for men and 18.2% for women, and about 18 million new cases are registered annually, means in yearly we have 18 million of new cases of this oncopathology malignant tumors, and most commonly the organs which are affected are lungs, breast and the prostate. So after breast cancer we have the second most common cancer in the man, which is a prostate cancer. So they are more prone, and we see the 18 million new cases every year with this pathologies. Now cancer is the second most common after cancer is the second most common pathology or disease in the human population after coronary artery disease. So okay, so this was your video, and last video we can see this image is your abdominal tumors, and there's a normal anatomy. You can see the stomach, spleen, all the cross section, right paracolic gutter, greater medulla, uterus, ovary, bladder, and appendix. Now you can see in this pre-operative condition before the surgery of the tumor, we can see many tumors, mucus producing tumor in the greater omentum. In the hilum of the spleen, you can see this tumor, and there are multiple implants of the mucus on the left hemidiaphragm and the spleen, left hemiside. Okay, and a large tumor in the your ovary, you can also see this is your ovary. Okay, so this is either to the side of the pelvic wall, it is attached. And in the paragolic gutter right, you can also see this is mucus producing tumor, this part. Okay, and like this in the surface of the liver also you can see. So there's a basic case for the abdominal tumors, all the abdominal when the cancer develops. So this is the case in the case of abdominal tumors. You can see in the hemidiaphragm, right hemidiaphragm also. So this was the video. Thank you.